Welcome back to another episode of Pelvic Confessions. I am Dr. Carrie Howe, joined by my co-host, Dr. Jean Chirac-Abrad.
Welcome to the show. On Pelvic Confessions, we have conversations regarding to women's health that women really should have, but oftentimes don't have an opportunity to have.
Yep. Each week we present these conversations as confessions that women have told me in the clinic. We always omit any details for sake of privacy.
So if you've been a keen observer, you would have seen the mugs changing seasons. One of the Carrie's big things was seasonal changes.
Finishing touch.
Sure,
That's
finishing
my mom would
touch.
say.
Finishing touch. It's a good. I think it's a nice little finishing touch to the show. But I don't think it takes a lot of figuring out why there's heart red mugs.
Yes.
It's February.
It's February, the month of love.
Isn't every month the month of love, Carrie?
It is. It is.
Guess it depends on the situation. But it does bring about interesting topics of conversation to be seasonal and on topic. Love has a lot of different angles.
Mm-hmm.
And when you're talking about pelvic physical therapy and pelvic care, that's typically an angle that's discussed through sexual connection or sexual intercourse.
Yep.
And it's a challenging love when it's lack thereof because of pain.
Mm-hmm.
And that's kind of what brings us to our confession today. You ready to get into it?
I am.
All right. So again, these confessions come from the clinic and presented through the voice of your patients.
Mm-hmm.
So patient said, I had a baby a couple months ago, but sex still hurts.
Yes.
And this is pretty common.
Yeah.
Right?
Very common.
And that's kind of scary because you just had a baby. We talked about it on the previous episode.
Mm-hmm.
If you're watching our postpartum episode, we covered a lot of changes that go through the body.
Yeah.
But this is a specific one. And especially like you're getting to this point of some normalcy and consistency. And then this happens. That's got to be pretty daunting and debilitating.
Sure.
For women that you treat.
Yeah. Yeah. There's so many changes. Again, we've done our previous few videos in gearing towards postpartum. And so this is a beautiful segue to now bring in the month of love and discuss sexual intercourse being a main function of the pelvic floor.
Yeah.
And so there are a lot of changes women have to go through during pregnancy and postpartum. And depending on how pelvic floor was impacted, that can linger for several months afterwards.
I know one of the common sayings, not just for us, but in pelvic physical therapy, common but not normal.
Yes.
And I feel like this definitely applies to something like this.
Absolutely.
That it's, you might talk about it or say it, and like somebody goes, yeah, I kind of had that too. And you start to normalize it. And it's got to be not uncommon for the thought process to go, well, is this it? Is this normal? Is this how it's always going to be?
Yeah.
That's tough.
It is. And when we're dealing with such an intimate topic too, right? People are uncomfortable about talking about sex.
Yeah.
It's a very personal experience. And so I think that is also a barrier for women who are going into the early postpartum period and things aren't functioning or feeling as they should. But there's this lack of knowledge and open communication of sex shouldn't hurt, and there are things that we can do to help.
Yeah, and that's not really the first question people ask, right?
No.
They go,
No.
how are you doing? How are you sleeping? How's the
Right.
baby doing? Somebody doesn't go up to you.
Yeah.
Hey, how's the sex life?
Absolutely.
So this is a conversation that really should happen and should be okay to bring up.
Sure. Yeah. My ladies even have a hard time having a conversation with their partner about this. Right. So again, this stuff is very intimate and so that's why we take such pride in what we do in our work with women, is because they don't oftentimes have these conversations with anybody else. And unfortunately, if there is a conversation with their OBGYN, sometimes it can just be chalked up to, well, you're postpartum and let the kinks kind of work out.
Yeah. Not the OBs that we typically work with. They know better. They're like, go see Carrie, get some pelvic physical therapy.
Right.
They're great sources for us. But one, kudos if you are talking with your OB, right? That's a great first step with anyone. But obviously, you said pelvic floor and muscles are involved in this process. So for the uninitiated that don't really know,
Yeah.
right? Because it could be that same thought process. I gave birth, things are still healing up. Maybe this is forever, maybe it's not. Maybe I'm healing up, best case scenario. But there is something that can be done. There's a
Yeah.
proactive approach.
Yeah.
I think that's kind of important to touch on.
Yeah, there's usually a few reasons as to why somebody is having pain postpartum,
Mhm.
right? I think we were briefly talking about this, but the three main common reasons why women struggle to or have pain during sexual intercourse postpartum can be muscle tension.
Mhm.
Those pelvic floor muscles, again, if they're on guard or carrying some type of tension, penetration can be painful.
Sure.
If there was any scarring, vaginal or cesarean. We have to keep in mind that when there's a cesarean delivery performed, that incision site is very low,
Yep.
and they go through fascia that is intertwined to pelvic floor. And so, and then certainly if there was any type of perineal tearing to the vulva or the vagina, scarring can cause pain during intercourse. And then the last one that is maybe less well known is hormones. Your hormones postpartum are different. They've changed, and estrogen is low, and that can cause vaginal dryness, which again can create pain with intercourse. But the good news is that we can address all of those things, whether it's one of them or a combination of all of them. There are things that we can do in physical therapy to help with that.
So, well, I'm curious at this point. So what are some of the things that you can do to address those things?
Sure. If we break it down into those categories, right, starting with the muscles first, we need to train those muscles to relax and lengthen, or in the world of pelvic floor, we call it down regulate. We need to get those muscles that are typically fired up and overactive to have some mobility and some training. So we do that through exercise and stretching and breathing and some relaxation techniques.
Is there a typical time frame? I know it depends, but how long does it take for muscles to kind of train and learn?
There's certainly a learning curve in the beginning for everybody, usually within a couple months, right? Again, it depends. I have honestly treated women who within a session or two, them just even being aware of those muscles, figuring out how to relax them, that they're able to go back into pain-free, pleasurable intercourse. I have other women who it takes a longer time to train those muscles to downregulate.
Is like learning different positions, does that influence pelvic floor?
Absolutely. Absolutely it can. Yep. And so we even have a whole chart in our office of sexual positions and options that influence maybe the depth of penetration or how it affects your low back, or there are advantages and disadvantages to each position, and they can kind of look through and piece through which one suits them best.
Okay, so that covers the muscles.
Yep.
What's next?
Scarring. So we can do a lot of manual techniques to the scars to specifically help with the desensitization. So when there's an injury, your body is triggered to have some pain and some protection there to that. Naturally, right? And so, we want to make sure obviously that the scars have healed and that they're well formed and we're not worrying about any type of opening. But still within, the 6-month time frame, those scars are still healing and maturing in that chronic stage of healing. And if there's a lot of sensitivity there to the nerves, we can help calm that down through different techniques with our hands, with other objects, training these women to do some massage at home. And again, that is both perineal and or an abdominal scar from cesarean.
Does the scar look different as it matures? Like, is there a visual quality, texture?
It certainly can, and it's very individual. A lot of that with healing, I would chalk it up to genetics. And so sometimes the tissues, ideally, a tissue would lay nice and flat and it would have good mobility. However, if there is some type of adhesion or adherence there, you're going to have a thickening of the skin that you can see and feel. And again, we can work on helping those tissues to not be so sensitive to touch.
I feel like I could see scenarios where a lot of women don't even want to touch the scars because of fear of what could happen.
Touch or even look at.
Yeah.
Right. So there's also a huge psychological piece component, excuse me, to this postpartum. That sometimes it is just a matter of getting in front of the mirror and putting your hand on the scar and connecting to that area of our body. When there's pain or injury, we tend to dissociate,
Yeah.
and reconnecting and kind of bringing yourself back into your body is an important piece too.
Yeah, that's huge. Okay, so we got muscle down regulation, working through scar tissue.
Yep.
What's number 3?
Last one's hormones, which certainly is not anything that we can treat, right? That is out of our scope. But if I do have women come in, or when I have women come in and I see that their vaginal tissues or vulvar tissues look like they could use a boost of estrogen, oftentimes we're getting them back into their OBGYNs. And it sometimes is as simple as having a topical estrase cream applied to the area. Again, when postpartum in general, estrogen has decreased. But if you toss on chest feeding into the mix, you have a suppression of these hormones, and your vagina and your vulva and your pelvic floor love estrogen. It helps makes them nice and plump in moisturized. And so when that's not circulating, there can be vaginal dryness that can be really painful. There are things that we can do a little bit more conservatively in terms of over-the-counter ointments to help. Certainly, the mothers have to be informed in terms of if hormone cream makes sense for them in terms of their health. But oftentimes it's more of just bringing it to their attention, figuring out where that pain is coming from, so then we can address it.
Does lubrication assist?
Oh, lubrication. Yeah, that's huge. Yep. Thank you for bringing that up. Yep. A good water-based lubricant is something that we want to make sure that we're encouraging our women to use.
And it's a progress, right? There's little gradual progress. Sometimes it's big, like you alluded to, but sometimes it's just a little bit better every time, right?
Yep. It's not typically a one and done. All of a sudden, now we're back to pain-free, pleasurable sex. It can be a little bit of a process to work through, but you should be seeing incremental changes and improvements along the way.
Great. So if this resonates with you, if you're recently postpartum or whatever time frame postpartum you are, but you're still having painful intercourse, please know that pelvic physical therapy can be an avenue to help, at the very least, come up with a strategy, but most likely come up with an effective strategy to actually deal with the issue. So if you're around Ellicott City, Howard County, or anywhere near the Maryland area, you can head over to restorepelvicpt.com to book an appointment with Dr. Carey. We do see patients digitally, so if you are not in the immediate area, we can certainly still see you if you're somewhere around. If you're not, find a pelvic physical therapist in your area. As always, you can head over to Instagram and now over to YouTube by checking out @RestorePelvicPT on YouTube, and you'll see a lot of these shows and feature content. As always, thanks for tuning in. For Dr. Carey Howe, I'm Dr. Gene Shirakabrad from Restore Pelvic Physical Therapy.
Cheers.
Cheers.